Good morning, I am Dr. Othonos Athos. Thank God we have reached the point of lesson 40. We will analyze a case once again, and we will do it the usual way. That is, first of all we read the case briefly, then the notes of the student doctor that has taken the case, and then we are going to see the background and to decide the miasmatic profile of the patient and his essence and whole picture in order to decide after differential diagnosis the remedy, the similar remedy. Let's begin. Woman, 22 years old. She has recently graduated from literature education. She is unemployed. She is trying to find some work to do in order to follow a postgraduate course in literature. 173 centimeters height, 80 kilos weight. She lives in Athens. She comes originally from Albania, but she is living many years here. The doctor notes down that non-verbal information that she has this extreme anti-conformist image, red hair, bright red hair, many earrings, 5-6 earrings, and one ring on the nose. Too much coffee. She even says that she doubts if she will be able to follow homeopathy due to coffee, and too much smoking. She comes for acne, the last 2 years. She had some acne in puberty, yet now the last 2 years she's got too much acne. She's got acne, not too much, yet she's very dueling about it, very worried about it, feels very bad about it, about her appearance. So no wonder why she used many antibiotics, and she's on retinoids, the last 6 months. Although these are very strong and harmful remedies. The last 6 months she takes retinoids. She is on retinoids. Her acne becomes worse when stressed. She also mentions recurrent colds the last 5 years. She had problems with her menses, with her cycle, since the beginning of the menstrual cycle at the age of 12 years old. She was diagnosed with polycystic ovaries. She has dysmenorrhea, painful menses all these years, and before menses she is very irritable, she has ups and downs, she is moody, and she is swollen all over. Cold 2, cold feet 2, oily skin 2, irritability. When they don't, what makes her angry? When they don't listen to me, don't pay attention to me. Ignorance in socio-political matters. not to be able to discuss with the other person because he doesn't have knowledge on these matters. She also gets angry from inconsistency because I am very consistent. With her brother, what makes her angry? When her parents favor him, take his side, he's 4 years younger, so she gets angry when her parents take the side of her brother because he is younger. She says that, nevertheless, I try to break him in and I succeed. She tries to break her brother, break him in, and I succeed to it, to dominate on him. What makes her angry with her mother? When she doesn't listen to me because she is stubborn, because she employs psychological blackmails towards her. Her mother is blackmailing her psychologically. What about her father? My father is my hero. He is the balance of the house. Nevertheless, he is absent and tired all the time, and he doesn't choose sides. She means that she turns to him to support her, but he doesn't choose sides. Companion. What makes her angry with her companion? When not honest. The doctor says that the doctor that took the case came to the conclusion that she is jealous towards her companion, although she denies it. She says that she gets angry when he looks at other women. When they go out, he looks at other women and he doesn't pay much attention to her. Then she gets angry. And what does she do? She gets angry and she shows it to him in a rather indirect way. She pretends to be angry for some other reason, not for him for looking at other women. Stupidity makes her angry. Slow-minded people, rudeness, indiscretion, injustice, when others try to impose things to her. She also gets angry when from men that try to dominate. She gets angry from male violence. She is afraid of being raped. She gets very angry when the other person is ironic towards her. When other people, especially women, show off. When she's in a company and another woman is showing off, she gets angry. Does she express her anger? Yes, she does too. Nevertheless, she expresses her anger mostly to her own, when she can express it. She becomes ironic too, especially to her own people. When other people may offend her, she will tell them off. She will tell them off in her own ironic way. The doctor says that took the case says that she is revengeful. She is sloppy too, and stumbling all the time in furniture and objects. Introvert 2, aversion consolation 2, aversion pity 3. She says about pity, when the other person pities her, who does he think he is? And she says that pity for her is the worst of all things. Lately she is worried about the health of her parents. She considers herself smart, quite smart, although she adds, that's what others say. Ambitious, 2. When she goes in the center of the city, at the center of the city, and it is crowded, and there are too much people and noise, when she gets back home, she gets worse and she may have a frontal headache. Worse car. When another person is driving and she's sitting on the back, then she easily gets dizzy. And when she tries to read a book in a moving car, she gets dizzy. Worse turns, when they go up a mountain and she's at the back of the car, she gets dizzy. We're sleepy too. When she starts getting sleepy, she is quite cold. She gets quite cold. She has ups and downs. She is very moody during the day. Her mood may change 2, 3, 4 times a day, many times without any reason, any apparent reason. She gets quite reactive if others try to impose something to her. She is afraid of loneliness, being without a companion, or if her parents are dead. She is quite insecure. Before going to a party or to a social event, she changes 2, 3, 4 times clothes because she is quite insecure if she has if she has put on proper clothes. So this is a first picture from this young lady. Let's see the background. We have to do with a young woman, 22 years old. She has just graduated from a literature course at the university. She is unemployed, looking for work, and she has the ambition to go and have a postgraduate course. She comes from Albania. She was raised in Athens. She is a little bit fat. She is fat. She adopts this extreme anti-conformist image, bright red hair dyed, many earrings, 5, 6 earrings on the ears, and 1 earring on the nose. The anti-conformist reactive way of dressing and appearing to others. Too much coffee, too much tobacco, and she says that she doesn't know if she will follow homeopathy because she drinks a lot of coffee. She comes to the doctor, and her main problem is the ache she has the last 2 years. She's very much worried and troubled about her appearance. So she has used many antibiotics and she's on retinoids the last 6 months. And she has all these problems with her menstrual cycle. She has a contradiction with her mother, because her mother, we can suppose that her mother is a very stubborn and domineering person, and the person that is very flexible in order to do things and impose things to her. I suppose her mother is a Lachesis woman, and that's why she says, the daughter says, that her mother uses psychological blackmails a lot. So the other supposition is that her father is the submissive person. The mother has the upper hand, is the domineering person, and the father is the submissive person. Why do I say this? Because her father is her hero, the opposite of her mother. Why is her father her hero? Because her father is the balance of the house. Nevertheless, she complains that her father is absent and tired all the time, and I believe that what makes her angry about her father or disappoints her about her father is that he doesn't choose sides. We can imagine that her mother is the domineering person. Her mother favors her younger brother, and her father doesn't choose her side. She says about her brother that I tried to break him in and I succeed. So she has this contradiction with her brother, and she's quite dynamic and tries to break him in. So this is the background. Even from the background, I start to suspect a Valeriana case and a syphilitic person, an insecure, reactive person. She has this, let's see the profile. Let's see miasmatically why I say so. We have this anti-conformist image. She's 22, she has graduated from literature, and she has this, she's not a teenager yet, anymore, yet she still has this intense red hair, dyed red hair, many earrings, and one earring at the nose, too much coffee, too much tobacco, problems with menstrual problems that match the predispositions of Valeriana, and too much care and insecure about her acne. So much insecurity that she uses retinoids the last 6 months, although she knows that it's a very harmful remedy. And too many antibiotics. Let's see these Valeriana combination of reactiveness, insecurity, and insecurity. Insecurity. Let's see first reactiveness. Reactiveness. Red hair, many earrings and nose, extreme anticonformist image. Reactiveness. When they don't listen to me, don't pay attention to me, what does she do? Try to break him in, her father. When they try to impose things to me, she gets angry. Injustice, rudeness, she gets angry from showing off of other women, from irony. She expresses her anger mostly to her own because she is insecure, and she expresses her anger to others by being ironic, although she hates others being ironic to her. I will tell him off. This is a very great characteristic and expression of Valeriana. When somebody offends her, she will tell him off. She becomes revengeful. This is also reactiveness. Aversion, pity, also reactive and being insecure. Who does he think he is? Egoism. Pity is for her the worst of all things. She has these great characteristic of ups and downs, 2 to 3, a very characteristic thing of Valeriana, especially at this age. She is reactive. What about insecurity? Let us see insecurity. Insecurity. Ache. Worried too much about her ache. Takes a lot of remedies for this reason. Other things that show insecurity. When not honest, jealous too, although she denies it, looks when her companion looks at other women and doesn't pay attention to her. Insecurity, men that try to dominate, male violence, fear, rape. Aversion, pity. Worried about her parents, fear, loneliness. We have to do with a syphilitic person. Why? It's not a psychotic person, because she would feel free to express her anger not only to her own people, where she can, but to all other people. And a psychotic person is more straight to his anger. Being ironic is an indirect way of expressing your anger. When you shout, you're direct. When you hit, you're direct. When you engage yourself in a verbal fight, being ironic, it's an indirect way. Most of the times, irony is not always, is the way the insecure people choose to fight. The syphilitic people. A psoric person doesn't become ironic. A syphilitic, insecure person chooses usually to be ironic. She is not psychotic. She is not psoric at all, because she is very egoistic and very egoistic, very ambitious, egoistic. How do we trace this, that she is egoistic? She is ambitious. A psoric person could also be ambitious, but we have to take the whole case. She is ambitious. She wants to go on a postgraduate course. She cares too much about her appearance due to insecurity. She says egoism. She gets angry when others have ignorance in socio-political matters and they are not able to discuss with her. She considers herself knowledgeable in these fields. Egoism. She complains that her mother favors her brother and she tries to break him in. Egoism. Her father is her hero because he is the balance of the house. She finds refuge to her father, although he doesn't choose her side as much as she would like to. Even from the number of reasons that she gets angry, we can suppose that she is very nervous, easily irritable, very insecure, and very egoistic. Many things bother her, and she reacts about it. So, this is a clear case of a Valeriana young woman, because she is syphilitic and she has this characteristic combination of reactiveness and insecurity. Reactiveness due to insecurity. Insecurity that she tries to hide well and not show to the others, because she is very egoistic and she doesn't want others to see that she is insecure. That's why she is jealous, because of insecurity, yet she tries not to admit it to her companion, although she gets very angry when they go out and he looks at other women and doesn't show care about her and interest about her. What other things lead us to Valeriana? What other rubrics are much Valeriana? Apart apart from those we have already said. The problems, the predispositions, dysmenorrhea, premenstrual irritability and distension, polycystic ovaries are characteristic of Walleriana. Acne after the age of puberty, also characteristic of Walleriana. The extreme anticonformist image, the too much coffee. Walleriana has the tendency to drink too much coffee because she is very nervous and she wants coffee, too much coffee all the time, and for the same reason she smokes a lot due to nervousness and insecurity. She goes out where there are other people in a company and she doesn't know what to do with her hands. She may start doing like this with her hair, or she may start smoking because of this restlessness in the hands. Walleriana is usually cold, usually has oily skin. All these reasons for irritability are characteristic of the insecurity and reactiveness of Walleriana. This jealousy towards her brother and her companion is characteristic of Walleriana. The contradiction with her dominant mother is also characteristic of Walleriana. A Walleriana person her relation with her companion is characteristic of Walleriana, and the fear of male violence and fear of rape is very, very characteristic of Walleriana. She also hates irony, but she becomes, when it is addressed to her, but she becomes ironic towards others. Slow-minded people make her angry because she is very nervous and very quick thinking and quick acting, although she may be lazy. Aversion consolation, introvert 2, and aversion pity 3 are also characteristic of Walleriana. And these also are characteristic of Walleriana. Getting worse when she goes to crowded areas, having headache afterwards, worse, becoming dizzy in a car, especially at turns or when at the back. When she gets sleepy, she starts becoming cold. She considers herself smart, nevertheless, she doesn't say straight, in a straight way, that she is smart. This is the conclusion of the doctor. When asked about what she thinks of herself, she says, others say that I am smart. This is an indirect way to say that I am smart, but don't think that I am a person that is showing off that he is smart. It's a clear case of Walleriana. We have prescribed Walleriana 1M, and her problems, her ache gradually became better and was cured. She stopped the retinoids after much effort to convince her because of her insecurity. and her menstrual cycle got well, and she stopped catching colds so easily. This is it. Thank you.